SoundBytes from Vet Advantage, an official publication of the NAVC. We're taking a closer look at Adequan Canine, polysulfated glycosaminoglycan, the difference between feeling better and getting better. You can find all the information in this video inside Vet Advantage magazine. Just look for the Adequan Canine Tear-Out. Let's take a look at the many key benefits and features to the only FDA-approved disease-modifying osteoarthritis drug. Then you can decide if Adequan Canine is the right choice for your veterinary practices. First, Adequan Canine has shown in efficacy studies it inhibits the loss of key joint components, including proteoglycan, collagen, and hyaluronic acid, to help promote a rich matrix for joint movement stability. In vitro studies confirmed it inhibits catabolic enzymes, which can destroy these molecules. Adequan Canine also delivers a proven and reliable difference to help slow the progression of canine OA. For more than 20 years, it has effectively helped improve mobility in dogs with OA. It reaches the synovial joint within 2 hours to proactively help treat the disease and reduce joint inflammation. Finally, early OA intervention with Adequan Canine can help more dogs enjoy more everyday adventures. It's estimated that 1 in 5 dogs over 1 year old may be affected by OA. Yet more than 50% of OA cases are diagnosed in dogs 8 to 13 years old. Many cases go undiagnosed or diagnosed late in the disease process after significant joint damage. Early diagnosis plus early treatment equals greater success with OA. Adverse reactions in clinical studies, transient pain at injection site, transient diarrhea, and abnormal bleeding were mild and self-limiting. When you're comparing products, remember that Adequan Canine is the only FDA-approved disease-modifying osteoarthritis drug for dogs. FDA-reviewed studies with proven efficacy results for treating the OA disease process in dogs. Approved canine formula, polysulfated with a low molecular weight, allowing for diffusion into the joint where it is deposited into the cartilage. It's shown to inhibit catabolic enzymes and promote anabolic activity in the joint. It's shown to reduce inflammation. Veterinary prescription only. Product quality assurance, consistency, and manufacturing are more reliable with FDA approval. Long-standing safety profile and post-approval monitoring and reporting of adverse events with FDA. Rethink OA, think D-mode. Owners want the best for their dog, and in a recent dog owner survey, it confirmed 92% showed interest when asked about a D-mode treatment, like Adequan Canine, for their OA diagnosed dog. Unfortunately, the study also indicated 64% of pet owners had never heard of the D-mode term for treating their OA diagnosed dog. SoundByte notes at the bottom of page 2 of the Tear-Out suggest ways you can discuss Adequan Canine with your customers. Start by asking, "Doctor, have you diagnosed any canine osteoarthritis patients recently? Are you aware of the benefits Adequan Canine can offer in the early stages of the disease?" Have confidence in saying, as an FDA-approved disease-modifying OA drug, Adequan Canine is proven to help slow the progression of the disease. And the earlier it is used to help maintain key cartilage components in your canine OA patients, the better chance for successful results. Invite them to learn more by saying, "Let's take a look at some insightful information about Adequan Canine," so you can see why Adequan Canine is a treatment you will want to consider for your canine patients presenting early signs of osteoarthritis to get ahead of the disease. For full prescribing information and more on Adequan Canine, check out adequancanine.com. Call American Regent Animal Health at 800-458-0163. or email cs@americanregent.com. Important safety information. Adequan Canine should not be used in dogs who are hypersensitive to PSGAG or who have known or suspected bleeding disorder. It should be used with caution in dogs with renal or hepatic impairment. Adverse reactions in clinical studies, transient pain at injection site, transient diarrhea, and abnormal bleeding were mild and self-limiting. In post-approval experience, death has been reported in some cases. Anorexia, depression, lethargy, and diarrhea have also been reported. The safe use of PSGAG in breeding, pregnant, or lactating dogs has not been evaluated.